An IVF cycle can be extremely useful. Most people think of an IVF cycle as only being a treatment cycle. Yes, we do IVF, we'll get pregnant. The reality, of course, you may or may not get pregnant in an IVF cycle, but it gives you a lot more information. It's not just therapeutic. It can also be diagnostic as well as prognostic. What does that mean? As far as diagnostic goes, it tells us precisely how good the quality of your eggs is. Thus, we have patients with low AMH levels, with poor ovarian reserve, but we lump all of them together as saying, oh, you have UPOS or diminished ovarian reserve. We don't really know how good each individual patient's egg quality is. But doing an IVF cycle, super ovulating them, seeing how they respond, tells us what their egg quality is. There's a big difference between poor ovarian reserve and poor ovarian response, and an IVF is the only way to make out whether the quality of your eggs is good enough to be able to give you a baby. But it's not just diagnostic, it's also useful prognostic information. Why is that? Because at the end of a cycle, we can tell you far more about what your individual chances are as compared to what your statistical chances are based on groups of patients. That's because otherwise you're forced to lump everyone together. But at the end of a cycle, we can check how many eggs you've grown, what the quality of your embryos is, how good your endometrium lining is. We have a lot more specific information. And based on this, we can give you much more intelligent answers as to whether you should keep on repeating the same IVF cycle or whether you should consider alternative options. So remember, an IVF is an extremely valuable tool for a doctor. Learn to make the most of it so you don't waste a lot of time in your pursuit of a baby. I'm Dr. Malpani. Please feel free to ask me questions on our website and I'll be happy to answer them for you.